This topic is cataract. Let's review a little bit of pathophysiology. Cataracts is clouding or opacification of the lenses, which leads to impaired visual acuity. As a client ages, their eyes age and the lenses in their eyes age. The proteins and fibers change and degenerate. This can be unilateral or can happen in both eyes and happens as the client ages. Other risk factors that can cause a younger client to develop cataracts earlier include trauma, smoking and alcohol use, diabetes mellitus, especially those clients with uncontrolled blood sugars, radiation or UV light exposure, like sunlight, and corticosteroid use. How will a client with cataracts present? This is a painless, progressive decline in vision. The client might state that it's like looking through a window that's dirty or cloudy. The client will report difficulty with driving at night and reading road signs. The client might also experience a glare or halo vision with bright lights. You can see in this illustration that when the light comes through, the lens, because it is cloudy, disperses and separates that versus bringing it in to a focused one point. Diagnosis for cataracts is done with an examination with an ophthalmoscope and also slit lamp microscopy, where the pupil is dilated so that the examiner can see clearly, and then they can determine the degree of cataract. When an assessment of the eye with cataract is done, it often reveals reduced visual acuity, opacified or cloudy lens, and then loss of red reflex. You can see here in this illustration that when a light is shined on the retina, it will equally reflect red. But in the case of the bottom illustration, you can see that opacified lens doesn't allow that light to get to the retina, and it appears white. Currently, there is no cure for cataracts, except for surgical intervention. The client may be able to put off surgery by getting an updated eyewear prescription, but that will normally only help temporarily. Cataract surgery is an outpatient procedure. The client will come in and will be given eye drops that dilate the pupils. They will also be given nonsteroidal anti-inflammatory eye drops, which will decrease inflammation or edema. In the actual surgery, the cataract is removed and an artificial intraocular lens is implanted. Surgery is normally performed on one eye versus doing both at the same time to prevent vision loss if complications arise. Generally speaking, one eye will be done, and then a couple months later, the other eye will be done. Surgical complications that we need to look out for are hyphema. This is when blood collects in the anterior chamber of the eye. The client will feel pain, blurry vision, and be uncomfortable. Other complications include intraocular infection, retinal detachment, and lens malposition or dislocation. And this is when the lens shifts after the procedure. Postoperative teaching for the cataract client includes knowing when to notify the surgeon after surgery. The surgeon must be notified if visual acuity suddenly worsens. The nurse needs to explain to the client that for the first couple of hours after surgery, your vision might be blurry, but every single day after that, it should improve. The client must notify the surgeon if that improvement is not occurring or if it suddenly gets worse, because this may indicate retinal detachment, which is a medical emergency and could cause complete vision loss. The client will also be taught to elevate the head of the bed 30 to 45 degrees to decrease intraocular pressure. The client wants to avoid all activities that increase intraocular pressure, straining during constipation, coughing, heavy lifting, bending over, or flexion of the neck. The client will want to avoid these activities until cleared by the surgeon, because an increase in intraocular pressure can cause edema, will pause healing, and may cause hemorrhage. The client will also want to monitor for infection, looking for redness or purulent drainage, and the client might want to wear an eye patch at night. This will protect that surgical site. Also, it'll protect any corneal abrasions that the client might rub their eye or scratch their eye, not even knowing it. The nurse will also want to observe the client and their ability to administer their own eye drops. Sometimes accommodations need to be made for a client who has something like rheumatoid arthritis. The client will be prescribed antibiotic eye drops, which will prevent infection, and then they'll also be given a prescription for corticosteroid or nonsteroidal anti-inflammatory eye drops to decrease pain and inflammation. In our teaching, we also want to teach the client what to expect, what is normal, because we want to reassure them postoperatively. We want to let them know that they might feel like there's sand in their eyes, and that might last 6 to 8 weeks. Also, they might experience photophobia or light sensitivity. This can last months, and they might need to wear sunglasses in bright light.